Welcome to the COVID-19 update for today, July 14, 2022. And as usual, we'll be speaking with the Minister of Health, Dr. Frank Anthony, on the sidelines of the National Tashau Council and Conference 2022. Minister Anthony, thank you for joining me.
Thank you very much for having me on the program.
Now, the first question that we have, Novavax is the latest newcomer in terms of vaccine creation, and one of the first to now get vaccine or authorization in the United States. What are your thoughts on this vaccine, and is this one of the vaccines being made to particularly treat Omicron variants, subvariants, and so?
Well, I think it's a good thing that we have additional vaccines being made available. As you know, when we saw the COVID-19 pandemic, a number of companies started to work on vaccines.
Right.
So you're going to see now not just this particular vaccine, but you're probably going to see additional vaccines coming to the market. They would have had to go through a process of doing clinical testing. So you have a phase 1, phase 2, phase 3 clinical trials. And then they have to present that data to the U.S. Food and Drug Administration. And once they green-light it, the U.S. Food and Drug Administration would first issue an emergency use authorization. Right. Then they can use it more into the population. So there are various steps. So this particular vaccine has gone through those steps. It is now coming to the market, and it's another option that would be available. The U.S. right now is using two vaccines predominantly. That's Moderna and Pfizer. And so this one would add to the amount of vaccines that they have. We generally use vaccines that we can access from WHO through COVAX. And we have used a wider range of vaccines, and we found them all to be very effective. Right now, in the vaccine stock that we have Pfizer, we have Moderna, we have J&J, and Sinopharm. So these are the four vaccines that we are currently using to give to our population.
Dr. Anthony, the ministry has launched a very extensive vaccination campaign for children. How is the ministry doing in terms of that vaccination campaign?
I think if we have closer collaboration with parents, we can get much more vaccinations done. So far, we would have administered about 4,000, a little bit more than 4,000 first doses, and about 250-something second doses. So we can do much better than that, but we require the collaboration of parents, because we cannot go and administer a vaccine to a child without parental consent. So there's an opportunity here, because we should really encourage the parents to bring their children to be vaccinated. Now, I think there's a myth that has been going around that children really don't get COVID, and if they get COVID, it's not going to be severe. That's really a myth, because for some children, they can get severe infections. And we have had on occasion children coming into the hospital. Those particular children were vulnerable because they had other underlying illnesses. So with children who are sick or they have underlying illnesses, they should actually be the first ones to come out and get vaccinated. And, we want to encourage that. But for children as a whole, if you are between the ages of 5 to 11, we have vaccines for you, and we want to encourage you to come and get those vaccines. The vaccines differ from the adult dose, so it's 1/3 of the amount of, 1/3 of the adult dose, basically. And so this vaccine has been tailored especially for children of this age category. It has been tested, it has worked effectively, and that's what we are now offering. We've spent more than 6 months trying to get these vaccines into Guyana. working with various partners to try to get it to Guyana. And now that we have it, we really want parents to bring their children to make sure that they can be vaccinated.
So, Minister, just for clarification, these vaccines, though school is closed, is still available for children to be vaccinated?
Of course, it's still available. And now that school is closed, they can come to one of the vaccination sites and get their children vaccinated.
Okay. Minister, just a little bit, continuing the conversation on COVID-19, can you give us the statistics as it relates to COVID-19 cases, the new cases that we've received, and the active cases that we've had so far?
So over the last 24 hours, we have registered 129 new cases. That, however, is not the amount of new cases that we have. And the reason why I'm saying that, there are lots of people who would do self-testing,
Right.
and if they test positive, they do not necessarily report it to us. So the 129 that we have now is probably an underestimate of the actual cases that we have. So I just want people to understand that. And we are seeing this in other countries too. So in some countries, they have stopped doing testing, and they have stopped reporting on testing. And therefore, you now don't have an accurate number of how many people are affected. We still do testing in the public system, so persons who come to us and we test them, then we are able to report on those numbers. But if they do privately or they do self-testing, and they don't report, we will not capture those numbers. So as of yesterday, we would have had 129 new cases. Currently, we have 918 active cases, and these cases are right across Guyana.